All right, welcome everyone. I call this meeting of the Monroe County Substance Use Disorder Community Awareness Commission, SUDAC, to order. Today is September the 20th, 2020, October 20th, 2020. This is going to be a rough meeting. All right, so it is October 20th, 2023, noon here in the Monroe County Courthouse. Welcome to all of you who are at the table. Glad you're here, and all of you joining us via Zoom or watching on CATS. Thank you for being here. As is our custom, we begin every SUDAC meeting with member announcements. Since I tend to be the least intelligent or experienced at the table, we like to hear what's going on in your area of the woods. Let's go ahead and start with our prosecutors department.
We are still working in child support, and we talk to people who part of the reason that they're not paying is because they're dealing with addiction issues and things like that. So we try to funnel them into services and, remind them that, the best interest of the child is paramount. So anything that they're doing to make themselves healthier is also going to help their child. And, we try to encourage them. We try not to always be punitive. We're always trying to be coercive in that provide them enough information and reasons for them to pay their child support. Doesn't always get through the first time, the second time, the fifth time, but we keep at it.
Good. Well, thank you for being here. Problem solving courts, anything to share? You don't have to share, but if you have something that you want to share, this is the time to do it.
I'm with probation, problem solving courts. We're plugging along as usual, working on reducing rules revocation. A challenge that I think you all are aware of. Problem solving courts. I applied for 4 grants 2 weeks ago to get money for our problem solving courts for urine screen testing, incentives, and training for our team members to go to hopefully Anaheim, California for a national conference. And then with CARES yesterday, we are working on, we need board members badly. We've got a listserv. Kathy's going to help us with that, send it out, and we're going to send an email. So you all may be receiving some emails to become members of our CARES board. We need people badly. So
yeah, all right. How many people do you need?
A lot.
Okay. All right.
We have, I can't remember the number of open seats we have. I'm guessing close to 10. You don't think it's maybe 8, 7 or 8, maybe.
Explain what you're doing.
So CARES is the local coordinating council for drug-free Indiana, where we collect counter interdiction fees for drug-related offenses. And we hand out, as a board, we hand out applications for grantees for alcohol, drugs, and other alcohol, tobacco, and other drugs for those basically nonprofit agencies that need money to help with treatment, supervision, anything in the community where that is concerned. And we meet on a monthly basis to discuss what the needs are here in the community, and then decide who's going to get grants and do the scoring. So anything you want to pick, you're the vice president, I'm the president. You can piggyback on any of that if you want.
Okay, we also do at least a yearly educational event around substance abuse prevention. So we try to do a lot of primary prevention as well. So.
Yep. Thank you.
Thank you. Public Defender's Office.
I don't have any updates.
Hi guys, my name is Whitney. I just wanted to mention a couple of things that we're doing at Indiana Recovery Alliance. For Halloween, we are doing a safe skate night at Western Skateland. There's going to be a costume contest and little prizes and stuff. And I was talking to the person that is like the manager of the place. So she said, no one comes on Halloween. So, it would be probably, almost like we rented out the place, with, our people like us. And we're inviting everyone that would like to join. also
Is
would
that, is
direct.
that on Halloween night?
Yes, it is on Tuesday, October 31st from 6 to 8. And Western Skate Land's off of 17th, West 17th. Also, I'm in myself and Ali Greider, who is a HR or harm reduction therapist, sorry. Harm reduction therapist, and I are going to start a harm reduction meeting. So we will have a therapist in the meeting every time and myself organizing it. And we would love it if we could somehow talk to the powers that be at probation to see if we can't have people come in and we can sign papers, like they do for AA. This would be like any other supportive meeting. So we would like to organize that to where, people that have to have signatures can get them when they come to our meeting. So we're hoping to start that up before the middle of November, probably. You'll hear more later, probably by the next SUDAC meeting. But that's all I have.
That's great. Yeah, we can help publicize that and get that on our agenda, and you can give us updates every once in a while.
Absolutely. I have flyers for skate night I can push to y'all. And I'll get more information about the HR meeting. I don't know if it, I'm sorry, harm reduction meeting. And I don't know if you guys would be able to help me somehow like talk to somebody that could tell me how to get signatures, papers with signatures, and make it an official meeting. Does that make sense?
Mhm.
Okay.
We can work on that as far as providing for attendance, right? For self-help meetings.
Yes.
Okay, yes. I'll follow back up with you on that. Okay.
Thank you.
You bet.
So let's move on to our health department. We have 3 health department representatives here. So Madam Administrator, you want to get us going?
I'm Lori Kelly. I don't have anything to share, but I'm happy to be here today. Thank you.
You're very welcome. It's good to see you.
Thanks.
Feel free to, whatever you want to say.
I'm Ashley Collins. I'm with Centerstone. This is my first meeting, but I plan on attending monthly now. And yeah, if there's anything in terms of like mental health or substance use stuff that are activities that are coming up, if you let me know, I can make sure I distribute that to all kinds of people, professionals, and to clients, and hang up flyers in local areas and that sort of thing.
Great. Thanks for being here, and look forward to talking more with you.
I want to talk to you after. Oh, go ahead.
I don't know that I have major updates that are not already being addressed in other things. We're having the lunch and learn, but these are all the other things that are on the agenda later. We did start our new harm reduction specialist last month, so that's really exciting. But if there's something that I'm missing that's also not on the agenda, let me know. I'm seeing expectantly. So.
Okay, I'm Kathy Hewitt, and I'm also with the Health Department. Just a quick, maybe share an announcement. We were talking in a meeting the other day about the 988 number, which everybody has learned about that and what that's for. But what a lot of people don't know is there's a text number for that too. And a lot of youth text and a lot of youth don't know about that. So we want to start promoting that and let people know that you can also text. And I believe it's text home to 741-741, but I would have to double check that. But I think we should also work as a board maybe to get that out on our SUDAC webpage and also promote it ourselves just to make sure that people know that.
What happens when you text home to 74141?
I think 741-741. A counselor will get in touch with you and it's having a conversation by text, asking how
Like
you
a
are,
live
what's
chat
going on.
happen?
It's a live chat. So
Mhm.
Is it home or help that you text?
I think you put the word home to that, but I will double check that during the meeting and I'll report back, but.
Yeah, that's wonderful. Great point.
Later today in this meeting, we'll be joined by Jamie Whitaker, who will be coming to talk about the Integrated Reentry and Correctional Support Program. Then we'll be having a formal session with him today at 2:00, and he actually will be here. He's on his way, unlike yesterday when there was a problem. But we also, to be able to implement the IREX program here locally, we have to put into place a recovery-oriented community, and it needs to be something formal, like Thrive that we heard about at the last Lunch and Learn. So we need to get some kind of 501c3 or something like that going, because that's what oversees and supervises the certified peers that will work with people once they're out of the jail. So we need to figure that out, and probably need to figure it out very quickly to make ourselves eligible to get this started in January, and to be eligible for one of the state pilot programs.
What qualifies as a peer? Or you said qualified peers?
They're certified, they
Or
will come
certified,
in and,
yeah.
and have they will do the training to help ensure that they have certified peers who can work with people out in the community. They'll do the training. Yeah, that's not a problem. Yeah. But there needs to be an umbrella organization for that. So I don't know, we may need to tap on Melanie and Kathy's connections, and because I don't think I ever got anything from Thrive on the stuff that they had put together. And so, but I think that's a really big deal. We had session yesterday with Mr. Whitaker. We're having one again this afternoon. And I know that some of the people here at the table will be joining us. So I'm very, very excited about that.
Can we use an existing organization if it's a non-for-profit, or do we have to build a new organization, or did they say?
I don't know. That's a good question. We can ask Mr. Whitaker when he gets here. I don't even know if it has to be a 501c3, but I know that the others in other places are. So, yeah.
All right, just one real quick update from the Monroe County Council. We worked really closely with our colleagues in the Commissioner's Office to pass the 2024 budget. It's a $112 million budget, and included in that was an 8.5% cost of living increase for all county employees, including employees that are doing things like harm reduction or working in the courts or things like that. So we're working really hard to retain the staff that is here in Monroe County that are doing the good work, and just want to thank everybody who is here that's been doing that work. And please continue to get in contact with me for the 2025 budget to see what that number is going to be. But we're really happy that we were able to get a nice cost of living adjustment, not only for all employees, but also we brought the minimum wage in the county up to over $21 an hour for full-time employees. So we are working really, really hard to make sure that folks can afford living. So, all right. Well, you're welcome. And I'm only one of 7, so I'll take a 7th of your thanks. All right, let's
Okay.
get going on our agenda. Nope. All right.
I just want to verify that what I said was correct. The crisis text line, you do text home to 741-741, and it's live, so somebody will get back with you. So
Great. Thank you. We'll push that out. Thank you for promoting me as panelist. I'm going to share our agenda on the screens just as a warning. When I was writing the agenda and then asked for a peer review, nobody caught that it's October. So I know. so sometimes peer review works and sometimes doesn't. Whatever.
It's a very busy time of the year.
It's a busy time of year. And you know what? Even people like us make mistakes. So that's good to know. All right, here we go. We're on number 3, Lunch and Learns. I know we had a great Lunch and Learn earlier this year, talking about the legal department and ways, or the legal profession and ways that we can address recovery in the legal profession. We've talked about that at length. We also had a nice Lunch and Learn recently, talking about RCOs and what's happening down in the southern half of the state. So I just wanted to open it up for any other conversation about Lunch and Learns. It's already October. So I think, I know, right? So I don't know if we want to do another one, or I think, or we just want to start planning for next year in terms of our lunch and learns.
I would suggest waiting and or planning for 2024 because it just takes so much if we, unless something comes up and it's all ready to like drop into place. Otherwise, don't think that we have the time and the staff with everything else coming down on us at the end of the year.
Yep. Okay, great. Any other thoughts? Seems like wise counsel from council. All right, great. Let's move on to number 4. We have 2 opioid settlement items. I know Commissioner Githens, you came and presented to the Monroe County Council on both the grant. That's really not big enough. On the grant as well as the settlement. Can you bring this group up to speed on both items, the grant and then settlement?
So we have to come up with some matching money to which we have proposed comes out of the opioid settlement money that the county received already through the state. And this would enable us to have $576,000 in additional grant money from the state. That's aimed at providing additional harm reduction supplies through our health department, to buying a home for the Indiana Recovery Alliance, and that is in progress. They have found a place, and we've completed phase 1 and are going to phase 2 of the review of the actual property to make sure that it meets certain standards, which is fabulous. And then they want to buy a new van. One of the problems that we found out is that originally when we did the budget to the state, we put in a total of $130,000 for the van because that's what state was indicating on a different grant they would give for this kind of vehicle. It turns out that Nick Foyles, who's been working on this for a good while, can't find anything even used for less than $245,000 because it's so specialized and has built-in compartments and refrigeration and other things with it. So we are trying to pry loose the extra money that we'll need so that we can go ahead and get that van purchased. He's identified one out in New Jersey, so we're hoping to move forward with that.
And Mr. Voiles just joined on Zoom. We can now see his face.
Aha, okay. So talking about you, Nick.
Great. I'm here. Thank you.
So we hope to, I think in November, have that on the county council agenda to get that money moved through to help with things. But Nick, I know with Whitney's help, but especially Nick has really pushed hard to get these things in place. So it's a big deal for the county to get that extra more than $500,000 with stuff to do.
Yeah.
And then in terms of opioid settlement money that the county is getting, we proposed, and I'm still waiting to hear who would be assigned from the county council to this, but we're just going to put together a work group to put together a proposal on how to spend that money. It's not a decision-making group. And so we've got a member of the judiciary who's agreed to be part of this. We've got Kathy Hewitt. Hopefully it's okay that she does this too. Somebody from the auditor's department, me, and somebody from our legal department. So if there's anybody else that really is dying to give up another hour or 2 of their life, let me know. We want to just move forward on how we think some of that money should be allocated, partly so that we don't just start spending $10 here and $20 here. We want to make a difference with what happens with this money. And again, if anybody has suggestions or requests too, please funnel them to me.
Nick has a question on Zoom.
Hey, boy, this is weird not being there in person, you guys. And so I was really hoping that someone with lived experience would be there. I really think we're really missing out if all we have are people from judiciary and county and everywhere else. That if we don't have people with lived experience who actually bled for that money, it seems like we're missing a really huge beat here. Maybe 1 or 2 people, at least from the community. Maybe I don't know how we'd work that out, but it seems like those are the people we need to be talking to about how to spend the money. You know what I mean? or at least have their say so. Is that possible?
I don't see why not. And I think that's a very, very valid point. I appreciate you calling that to our attention. Thank you, Nick.
I figured you would. It says something that sounds like right up your alley. And thank you for your talk the other day at in the appropriations, and thank you for constantly being a great help to all.
Thank you, Nick.
All right. Any other questions? I just wanted to share a quick document you can see here. This comes from our auditor's office. As many of you know, there are 58 counties. The settlement status is the national settlement, which is for manufacturers and distributors. And there's a bunch of pending settlements. The Attorney General put together some estimates for what's going to be appropriated to Monroe County out of these settlements. And here you see there are essentially two buckets of revenue streams for Monroe County. There's an unrestricted bucket and a restricted bucket, and we can talk about those if we want to. I will send this document over to Melanie so that we include it in the packet or the minutes for next time. We could send it out too. But as you can see here, there's all sorts of links you can click on to get a plethora of information about the difference between restricted and unrestricted in these dollars. And I think that's where I'm going to leave it here. We could probably spend hours talking about this.
Well, I think it's important to point out that the settlement has not occurred with those companies that were listed in the table at the top. And so we're hoping that there will be additional monies coming through. And we also have not yet effectively partnered with the city of Bloomington on how they will spend their opioid settlement money, because they have additional money as well.
Any other questions, comments? I mean, it's a lot of money. And there's a lot of counties in Indiana that are going to be receiving this. So
Seems like we can do a lot of good with this money.
well,
Yes, I agree with there. We can do a lot of good with this money.
Just we have to be thoughtful about it, really thoughtful about it. But yeah, I think there's some great strides we could make with this money. We could really make lasting change here in Monroe County with that money.
Yeah, I can think of several ways to spend it.
well, and I think this is the wisdom behind putting together a group
Yes.
to have conversations across sectors.
Well, and even some of the items that we had proposed in the grant application, sort of the drug drop boxes where people could dispose of unused, even prescription medications and stuff. That would be ways to use this.
So if you have any questions or comments about that group, talk to Commissioner Githens. I will make sure that you all get that document that I just shared with the dollar amounts. Those are in estimated dollar amounts, by the way. If you go to the Attorney General's website, they will have more up-to-date information if you so choose, or you can talk to me about that and I can work with you on that. All right. Clear as mud. Excellent. Let's get back to our agenda here. So we just talked about the opioid settlement grant. Congratulations again on that. That's a big win for Monroe County. And the opioid settlement, which is quite a bit of funds we just talked about. So do we want to move into IRACs, or do we want to wait and talk about other things until Mr. Whitaker gets here?
He should be rolling up within the next 5 to 10 minutes. So why don't we move on?
All right, Melanie, I'm going to kick it. I'm sorry. Well, we're going to kick it over and talk about CHIP. Are there any updates for CHIP?
I was going to say that I think there's something in the chat that popped up. I don't know if we can read that, or if it was relevant to the last topic, or if it's relevant to this one.
Mr. Voiles put in the chat, we put in for a grant to put up an empty Sharps kiosks and such.
Cool.
Nick, you got a thumbs up from everybody here.
And then in terms of the chip, so we're kind of wrapping up the cycle of the chip, looking to address some of the barriers that are in control of the participants that have been participating in this mapping project before the year end. So when we were talking about sharing more about 988, connecting other resource providers that maybe weren't otherwise aware of each other's existence. When we put the map up, people said, I don't know who this person is. And I said, I can send you an email, I'll connect you. So we're hoping that the folks that have been participating in the mapping process are going to continue working together. Maybe that'll look like some of the SOFR or the suicide and overdose fatality review teams, since there's a fair amount of overlap in those barriers that were identified there, as well as what the SOFR recommendations are. And also knowing that substance use and mental health is probably going to be an area of need for the next cycle of the community health assessment, or CHA. We're hoping that some of this momentum will move forward while folks are, pushing out the survey to the people that are their colleagues, the people that they're working with folks on establishing focus groups. So if you're interested in participating in that, get in touch with Kathy or myself.
Just to recap, we're working on CHIP and we're going to move on to CHA.
Yes.
All right.
Yes.
I think it's
Oh, okay,
old.
that's it.
It's just old.
Okay.
Are there any questions about the CHIP updates, those 3 updates that we just received? I have a question. The mapping project, when can we play around with that? When is that going to be available to the public? When?
I think I sent out the map to this body earlier, but I can make sure that I send that with the notes as well. And let me know if you've got, I don't know, things that you'd like to add, things that don't make sense, a way that it would be more useful for you. I think that I've gotten recommendations that we blow it up pretty large so that people can kind of interact with that. And also I'm thinking about the NAMI sim mapping, if that's something that we pursue. I think that those would dovetail
ready
really
to go.
nicely together.
Put that together.
I think
we got the final person we need. For that.
I think if we can take the map and then share it with the next NAMI group, I mean, you have the map to prepare and see what everybody or people have contributed, to see where everybody's outlined, see the barriers, then take that information into the big group. It would be really well to work together. It would just build up each other and we could get even farther faster. So
Yeah. We have a new person at the table.
Yeah, I'd like to introduce Jamie Whitaker. He's with Mental Health America of Indiana. He's a vice president for forensic and forensic services. And he's the person that we're looking to help us get this IRACS program here in Monroe County. If we did, we'd be one of the first in the state. And so we're going to let you have the mic for about 2 seconds, Jamie. Is that okay?
Oh,
He's actually rushed down from Indianapolis.
Do you want to catch your breath for a second and we can go around the table and let you know who we are? Yeah. All right.
Okay, you already know me, so too bad.
Kathy, can we start with you?
Yeah, absolutely.
Kathy is the person I even found out about. She's the one that clued me into the program.
I'm Melanie Veslige. I'm the Senior Community Health Specialist at the Monroe County Health Department.
Hi, I'm Ashley Collins. I'm with Centerstone.
Lori Kelly with the Health Department.
My name is Whitney Meeks. I work at Indiana Recovery Alliance, which is our local SSP. Also, I wanted to tell you all, I just found out I am now certified. I am a certified community health worker. I just got the notification that I passed the exam.
Welcome.
So I just wanted to tell y'all.
Congratulations.
Thank you.
That announcement is going to be enshrined into perpetuity through CATS. So you can share that with your grandchildren and their kids.
I'm Karen Runbeck. I'm a deputy public defender here.
I'm Steve Malone. I'm probation officer with Problem Solving Courts and Probation Department.
I'm Patricia Cummings. I'm one of the deputy prosecutors.
Peter Iverson, I'm on the county council, so it's the fiscal body.
You woke me up yesterday, made sure I didn't get lost.
We rode an elevator together and I told this group that the elevator got stuck and we had to crawl through the roof, but no one believed me.
My luck, it wouldn't surprise me at all.
You will need to speak in the mic, but several of these people will be joining us at 2:00 also. Okay.
Great. Yes, I mean, so again, it's a pleasure to be here. It's been great to connect with different people down here about IRAX. I know Penny drove all the way to Indianapolis to listen to me give a presentation, which I always apologize for. And it was great to connect. And you know, Bloomington's a great community, and I've had great meetings with folks. I had did a really interesting tour of the jail here with the sheriff and his team, and got a chance to learn from them some things they're seeing and facing there in the jail. And again, I think, you know, I know you guys have a new jail coming down the pipeline at some point, so there's lots of great things happening here, and I'm glad to be here. As far as IRAX goes, and you guys will hear more, some of you will hear more of this at 2:00, but we've been going now pretty strongly. I mean, both on the original program that was there was going since about 2019 on, and the pilots have been going on since June of 22. We're in our second year of funding from the governor's office, thankfully, and DMHA, and we're looking at launching new sites. So one of the things I'm doing is I'm communicating with we've had a lot of communication from about anywhere, a big section of the state, and one way, shape, or form talking about IRAX. And we've been going around and meeting with communities. We have what we call a readiness survey that we do, and it just gives us an opportunity to learn about the community. And then there has to be certain components in place in order for us to even consider launching an IRAX program. So my job is to meet with the communities and do that survey, take that information back to our state partnerships and have conversations. Then we're identifying where the funding is going to go. Honestly, it's kind of a first come, first serve. So whoever passes the surveys first, once we meet our 6, which is what we have funding for, and then after that, we'll cut it off, at least for this year, and then start looking towards next year. But we're also helping sites understand what they need to get in place to have this program here, because it's such an intense program that we learned early on that if you don't have the right components in place, the program suffers, and it really causes more problems than it really solves, which is why we have that readiness survey. So it's really important to have these specific pieces in place. And it is a recovery program, so it is completely driven by people in recovery. The program is operated by people in long-term recovery, and it's part of the sheriff's team, and it collaborates very intimately with every part of the criminal justice system and external providers very comprehensively. So I'm very happy to be here, and I'm more than willing to answer questions, but I'll be going to more depth, I think, at 2:00.
Well, we did have one question already, and that is, what would it take for us to have this certified recovery community organization? Does it have to be a 501c3? And I know that you've said that you'll send down another person from your organization to help us get some of that in place, but would you talk to us a little bit about that? Because I think that's one of the missing pieces.
Would you two mind scooting a little closer to
Sure.
me? I put on deodorant today, so it's okay.
That's okay.
No,
Okay.
it'll be easier for the cameras to see the both of you.
I was more worried about me. I've been in the car drive. Yeah, I was in Marion County Jail all morning this morning. So, yeah, I mean, we have so many great providers and across our state. We have incredible judges, prosecutors, public defenders, health department, probation officers, community corrections. We have so many great systems. I had the same thing in Howard County where I originally worked and lived. Great people, great courts. We had 5 problem-solving courts. We had really comprehensive community supervision, probation, and corrections. But peers have an opportunity to connect with people instantaneously. Like I went to the Marion County Jail this morning, and they marched 27 people into a room who have never met me before whatsoever, all wearing orange jumpsuits. I sit down across from them group. They had no idea, other than that they signed up for a group, why they were there. They had never met me, knew nothing about me. And in a course of 5 minutes of talking to them and just giving them a basic, I didn't tell them my personal story, but just letting them know who I was. They see my tattoos. They're like, who is this guy? Why is he in here? I tell them I'm in long-term recovery. I tell them a little bit about my story, and instantly there's a connection between us, and it kind of, all the walls kind of fall down. Right. And so then they start opening up. And so I spent 2 hours there this morning with 30 some different people in Marion County Jail that have never met me before, that are struggling with substance use disorder, that are struggling with mental health, that have criminal charges, that are facing incarceration now and facing further incarceration. And before it was over, I'd learned a lot about all of them, opened up, very transparent, really shared some things. And I left them with an idea of understanding that if they really want to make a difference in their lives and their criminal justice process, the more they can help the people who have the power to make decisions, the more they can help them understand what they're really struggling, what's really going on, the more people are going to try and be able to make a difference in what's happening to them, right? Because it feels like it's happening to them when they're incarcerated. It does. You know, you made decisions to be there, but it feels like it's happening to you. So part of the goal of all this is to take all these great providers and partner them with people with lived experience to bring in that transparency, to build a bridge between providers, to help people understand that your probation officer is not your enemy. I mean, no one goes to school for 4 years so they can figure out how to punish people, right? Like I went to school because I want to help, right? But I have a role that I have to do. I have a job that I have to do. So how do we build bridges? And peers are really incredible at building bridges, being very adaptive. So IRACS has been as successful because of this recovery community organization and peer support network we have here in Indiana, which we're very grateful to have. We're very few states in the country that have, I don't think anyone has a structure like what we have here. So we've been very grateful for Governor Holcomb and DMHA and other leadership for building that. But what this accomplishes is it allows us to layer in these intimate, very interesting recovery resources with all of our partners to bring a new dynamic to the work and hopefully bring more information and more, be able to work in a more that's more culturally relevant to the challenges that people are really facing. So recovery community organizations is a formalized organization by people in recovery for people who are struggling with addiction and or mental health or substance use and or mental health, right? And those recovery community organizations are housed underneath the umbrella of a 501c3. It doesn't mean that they have to be at the time when they're started. They can be, their fiscal agent can be another 501c that becomes their covering, financial covering while they get up off the ground. But they need to have a 501c, need to have a basis and a way that we can fund them from a state level down. That's what the 501c3 is so for. So it doesn't have to necessarily be them. Some counties have another, like a church or other people who say, hey, we'll be your 501c3 umbrella, and then help them get off the ground. But it helps them formalize that organization so that they can get access to different state resources that are specifically for recovery community organizations like IRACS. And because we build it that way, to fill gaps in the systems and fill gaps in the recovery ecosystem here in the state of Indiana. So once you have that, once you establish the 501c3 partner or the organization, formalize that, we have several organizations here in Indiana that have been funded by the state. One is called Thrive, another is called Indiana Recovery Network, that is funded by the state to help those organizations formalize, create a board of directors, create processes, procedures, policies, the way they operate, a formal board, put themselves together and organize in a way that helps them become a functionally efficient program that can then provide that ecosystem and recovery support for Monroe County. And so we have partners on the state level that do this, that are paid by the state to do this. We have a formal process. There's a way to become a certified recovery community organization, which then allows you to access additional funding. And our state has set up funding pieces and continually offers grants and other things that are opened up for these recovery community organizations. We have ways of certifying peers, like so congratulations on getting your certification. We have ways to certify peers. We have additional peer certifications coming down that we're working on for forensic peers. We're working on that with IRACS. Eventually, we're going to have an IRACS certification where, depending on how well your IRACS program is operating according to fidelity, if it operates according to fidelity, you can get a certification saying it's operating at fidelity. So we're building formal processes, which makes it a system. The more you have a system, the more you have infrastructure, the more infrastructure you have, the more funding you have. So that's what it is. So I will be absolutely connecting you guys to Heather and others that I believe will be able to help continue. And we're going to have some more conversations about this today, but that's what an RCO is. And it really does give that grassroots peers a place to have a seat at the table and have conversations like this and be a part of these conversations. So it's so great to see someone in recovery sitting here at the table. I mean, that's a huge kudos for this group here. A lot of places we don't see that, but we're seeing it more and more. And then helping those peers be partners in a place to, as we expand that ecosystem out. And so that's what IRACS does. It puts the recovery ecosystem in the jail.
I just wanted to let you know that we have another person in recovery joining us virtually. So
two, Sarah and Nick, I didn't extend the invitation to introduce yourselves on Zoom. If you'd like to say hi, now would be a good time.
Hi, my name is Nick Voiles. I'm the Executive Director of the Indiana Recovery Alliance, and I just love what you do, and we're really excited to have an RCO here. It's been a dream of mine. That's what we're working toward. We are directly in contact with Thrive with Phil and Kelly Hans and Sharman Gabbard to help us set this RCO up when we get a chance. And I love what you said. Sent shivers up my spine. I love when we get to these places. So thank you for being here.
Thank you so much, Nick. Thank you. Yeah, we have great partners. So, and the good thing is we've been doing this since 2019. We know how to do it. We know how it works. We know what works, what doesn't work. So we can bring those partners in. And then my job on the backside of that is to oversee all the IRACs, so the forensics, so the courts, community corrections, probation, and obviously the jail. So that's what we do with the IRACs program. But you have to have that RCO set up and established in that functional capacity. And then we look at how we fund community peers. So how do we have people, because if we're going to have a jail program and have people who are going to help people get out of jail and be successful, my team works on jail. And then during the transition period out of jail, we still have to have a community team to stay with them going forward as long as they need. And there are resources in the setup for that. So it's 2 teams, both housing that RCO, and there's funding pieces that are attached to both of those. So I hope that makes sense.
Are there any other questions? Comments?
I have one question. So if you've been working with the jail, what does the readiness assessment look like right now?
So the jail, I mean, I think that the biggest challenge we had when we did a tour of the jail, obviously, is space in the jail. So it's a very tight space there in the Monroe County Jail. But what I will say is, kudos to the sheriff and his staff. They've done an incredible job of utilizing every ounce of space there in the jail. I know that there's works and plans for a bigger jail, more space. And we did come up with a plan. We believe that we can make work there in the jail. The sheriff was very accommodating. I think he's done such a great job. He seems very visionary and wanting to really do everything he can to support people who are in his jail and in the community. So the jail was great. We completed both pieces of that part of the survey, and I believe we have a pretty solid plan in place to successfully meet that need.
I had a question. So in the past, like I actually in Monroe County, I ran a jail program here for 5 years through Centerstone. And I got cut because of funding. But one thing I came up against with getting peers into the jail to teach things were those background checks.
Sure.
And I had fabulous peers that would have been amazing to going in, and they're like, no, because of their past charges,
Yeah.
unless it's been like, I think like 10 or 12 years since then, they can't get in there. Do they just agree to go ahead and let them in there, or are there certain stipulations with background checks for peers?
So it's a great question. Actually, lots of great questions. So one, I mean, I always crack a joke. I always tell everybody that when we put out a job application, we say felonies required, right? So I mean, and I don't mean to I'm not trying to make light of anything. My point is that someone's history and their challenges in the past do not define where they are. I mean, you're a living example of that. So am I. Lots of other people are. I think that we faced the same challenge when I first started this out. It took me, when I originally did this myself, I did this originally myself in the jail by myself when we first started. And it took 1.5 years to get the sheriff agreed to let me in the door. And my record's expunged, it's gone. It took 1.5 years to get him to let me in the door. Of course, I look a little rough, right? Secondly, then it took another half a year for them to realize that, hey, you know what, that if they're working with your program and you're telling me they're certified, that they've been vetted, we're going to do a criminal history check. We do a criminal history check on everyone. And there are some charges that are going to disqualify someone from being in the jail. It just is. But again, it's not because you have a criminal record or felonies that's going to keep you out of there, right? That's what makes you relevant for the work that we're trying to accomplish. And we do an enormous amount of training. I mean, the sheriff and I had a long conversation about it. He's very thorough, wants to make sure safety is primary and every concern that he has. So we had long dialogues about this. And I believe that we train the teams intensely. We make sure that folks are certified by the state, which state has a very formal process for all of that. We do vet and do background checks. The teams work very intently with not only criminal justice partners, but our IRACs teams are literally a part of the jail staff. So there's such close knit group. if someone on our team was struggling, we'd know. I can tell you, you know, we're almost 2 years into this, and I can tell you, we see that there is people sometimes struggle, they do, but we know ahead of time it's happening. We're very transparent. We work very closely. And because of those things, I mean, if you go to our sheriffs and our counties now, they're like, we don't even hesitate, right? So the peers act like professionals because they are professionals. And we have a very formal process, it's a very intense program. Everything operates kind of like a well-oiled machine. And then we're trying to do our best to get to those stories and build relationships. And so it's to this point, you know, almost 2 years in, we've not really had any major hiccups or challenges around that. So I think some of that makes it easier for the sheriff here in Monroe to say, okay, I've got lots of other sheriffs I can talk to who are like Tony Skinner, who came down here. We haven't had any major issues. The program does do a great job. We have an ethics whole program we follow here in Indiana. Everyone gets trained on ethics. We have an ethical violation process. So if you do have a problem with someone, that gets vetted up and then gets very intensely scrutinized and looked at, we try and provide people support. So because we have all that infrastructure in place, it makes it much easier. And we do really intense supervision, both on the local level, and my team is very involved with all the IRACs across the state. So all those layers makes it a very safe program for the peers inside the jail. So I totally understand. There was a point in time, I think, when that was where we were at the pendulum, but I think we've in many ways gotten past that. But I have had sheriffs that are just not there yet. So
Are there specific charges that you talked to our sheriff about that they would not be allowed to be in there, and like what would those felonies be?
there's several. I think that I mean, one that comes to mind, and there's several that we look at. And again, sometimes it's more individualized, like there's something in the history, we need to dig deeper into this, figure out what the circumstances were. One we look at pretty intently is anyone who had a trafficking charge to do with a facility, like a trafficking in a prison or trafficking in another jail. So if that's a charge that's in the history, it's something we need to vet and scrutinize pretty closely and look at. And then again, anyone who some people have, you know, a violent criminal history or something in their history that is questionable or intense. And so we look at those very carefully. Ultimately, it's up to the sheriff what they decide to clear and not clear. That's their jail. And then from there, once the sheriff's department gives their okay, that, hey, the team's okay, and it is a process, then we begin that whole long training process with the peers.
I'm gonna thank you for that explanation. I'm gonna push pause for just a second. We have 5 more minutes in this meeting. So
Okay, I'm sorry.
no, it's okay. That's okay. The good news is that in 1 hour in this very room, there's gonna be another hour and a half full of this type of content, and I presume you're gonna be answering questions there too.
Absolutely.
Excellent. Before you all, you see minutes from this body. If you could take a look at those, and after you've given a nice look over, I sure would entertain a motion to approve these minutes.
Can you put them in the chat so I can see them?
Nick, what was that?
I'm not there, so I can't read the paper. Guys, hey, could you put them in the chat for me so I can read them?
They would have
Nick-
been the ones that were sent in.
Oh, okay, yes, then, okay, I know.
Yeah,
that.
they were
not
sent
last
out in
month,
email
for the
night, yeah.
previous months.
I got them.
Yes, they would have been sent last month. So if you
Yeah,
could
I got
look at your email for SUDAC meeting minutes.
I got them. Thank you.
But I'd like to make a comment. There's no date on the minutes.
We know the
Can't
date.
get anything past Commissioner Githens.
With the
We all-
addition of the correct date for the meeting minutes, would that be in addition to those that we can add verbally? Yes.
Yeah.
Okay.
All right, we have a motion to approve the minutes with the addition of a date on it. Is there a second?
I'll second.
Second.
Hearing a second, all those in favor of approving these August minutes, please say aye.
Aye.
All those opposed say no. All right, the ayes have it unanimously. Thank you for adopting these. Just real quick, there is going to be a lunch and learn today over at the Monroe County Health Department, which is a block that way, block north of here, regarding the Connection Cafe and Vigo County. So if you have time today, come and have lunch with us at the health department to learn about all that, excuse me. And then right at 2 o'clock, right in this very room, we're going to hear more about the IRACS program. So that'll be the third installment of these. And the second time we'll hear from Mr. Whitaker. So please come back. We have 3 more minutes in this meeting before we need to all head over to the health department for those who want to. Is there anything else that we haven't discussed that we need to discuss?
Do we need to talk about a subcommittee or something to work on the summit? Or is that something that we can do?
Yeah, so the opioid summit for Monroe County, we'd like to have that in 2024. Last month, we were scheduled to talk about that and didn't have quorum. And this month we had enough people and a lot of content. So I agree that we need to look into something of a subcommittee. I think I need to talk to county legal to determine the appropriate structure for that. And I'll follow up as soon as I can with all of you on that.
Also, I'd like to ask, will today's Lunch and Learn be recorded? And that people can watch it afterwards, and where will they find that link?
Yes, today's Lunch and Learn will be recorded. The one from last month is currently on the SUDAC presentations sub page right now. And we'll do the same thing with today's Lunch and Learn as well. But if you do have any questions for people in the room, send them to me. And if you're listening, I guess put them in the chat or attend in just a moment.
Can we not attend virtually?
You can attend virtually, and I had sent, I can send you that link as well. It should have been in one of the emails that I've sent really recently, but I can do that also.
It's
Yes.
okay if it's in a recent one, I've got it. I was just asking.
All right, it is 1 o'clock, good people. The next meeting of the Substance Use Disorder Advisory Commission will be November 17th, 2023 at noon in this very room. The county calendar will be updated. So if you go to co.monroe.in.us and look on November 17th, you'll see that meeting as well as the agenda. That agenda will have the correct month on it. Promises, promises. That's what you get from a politician, right? All right. This meeting is adjourned. We'll see you all back here in 1 hour.
I want to point out I'm a public servant. Is that okay?